Hello. Good evening, fellow friends and loved ones. Yes, it's once again an honor and a privilege to come to your homes for the last time in the year 2020. Yes, this year has been so wonderful. In fact, it's been the grace of God. Every single moment in time, from January to February to March to April to May to June to July to August to September to October to November and finally to December, the Lord has been faithful. The Lord has been good to us. Some ups and downs, some flaws and some victories, and some wonderful events has occurred in the year. We give glory to God, and His mercies has kept us. And today is our final discussion on a very important topic as related to various health conditions we've been discussing in our previous weeks. And today is no exception. Today promises to be a very interesting topic, and I believe that we will learn a lot. And after the discussion, if you have any questions, you can ask, and we are really ready to answer you. Okay, so today's discussion is on the topic pulmonary fibrosis, as we've seen the flyers roll out during the week. Pulmonary fibrosis. So when we talk about pulmonary fibrosis, it means two things: pulmonary and fibrosis. So pulmonary means it's near your chest region, that is your lungs. Your lungs is a structure that helps you to breathe in oxygen, that is air, into your body so that you can live, and then also bring out the one that I know use, that's carbon dioxide. So when we talk about pulmonary, the common name is called the lungs. And then when we talk about fibrosis, it means growth that is forming scars, that is wounds that have been healed, and then the leftover has not released well, and so they form scars which prevents other functions of the body system from working very well. So we're talking about pulmonary fibrosis this evening. And so simply put, pulmonary fibrosis is forming scars around your lung region. So the condition in which the lung tissue becomes, three words, it becomes thickened. So there is a structure around the chest region. There are two we call lungs. You have the left lung and you have the right lung. So they all take in oxygen. So when you breathe in oxygen or breathe in air, it goes into your nose and then it goes into your structure called trachea, and after the trachea it goes into your bronchos and it goes into your lungs for the air to go into your body system to allow other body parts such as our eyes, our nose, our ears to be able to function very well. So pulmonary fibrosis is a very important condition. So the lungs actually have tissues, and these tissues become thickened, they become stiff, and then they become scarred. So some characteristics that are able to identify this condition through various investigations such as X-rays, MRI, we'll be talking about very soon, is the characteristics that the lung tissues become: one, they become thickened; two, they become scarred; and then also they become stiff. So when we observe various investigations and these three characteristics bring out or show out, then we can say the person has pulmonary fibrosis. So just a simple mechanism by which this occurs is that the body takes in air through the nose right into the lungs. As we said, we have two lungs in the body, the left and the right. So when the body takes in air, the lungs pick the oxygen from the air and then push them into your blood for your blood to send into your heart. And your heart needs oxygen to be able to function very well. So when the oxygen goes into the heart, it goes to purify the body system and sends it, pumps the blood right into your body, into your brain, especially your brain, your eyes, your legs, your shoulders, every part of the body. So in this case, they allow the body to function very well. But in some cases, the lungs, due to various instances, which we'll be talking about the causes, they become injured and in the healing process, they don't heal very well. So they form some things we call scars. That is, remember that when you get hit, so you can see my hand here. It's good that I got hit. Yes, you can see my finger here. There are some patches around my finger here which are almost healing. You can see them. Yes, so you can see them here. So in this case, if these patches form in the lungs, such incidences cause the lung to be narrowed in terms of space. So when the air is coming, because the scars have formed plenty as a result of healing, they don't allow the oxygen, that is the air, into the lungs for them to be sent to the body through the heart. So in this case, then the body is deprived of enough oxygen, and there are so many side effects of this. We'll be talking about this very soon. Okay, so we have one of the major type of fibrosis called the idiopathic pulmonary fibrosis, and this is actually not known. We don't really know the cause, but some people are attributing it to be chronic. So when there's continuous injury to the lungs, they form scars, and then this causes oxygen to be deprived, and then there's other signs that show that we're talking about. So actually it occurs mainly in adults, yes, primarily in adults, and it limits their function, because as we grow also older, we tend to be less able to perform our various activities as expected. Okay, so one thing is that we should know that our lungs are very, very important. Without that, in fact, we can't survive. Yes, we can't, because that's where oxygen comes from. Okay, so diagnosis of this condition is very, very critical, because we need all expertise to come into place, especially the radiologist or the radiographer, the medical doctor. These two people are very important, and subsequently then treatment, other specialties such as and then also the medical laboratory scientists, and then after that we can have the physiotherapists come into place to be able to restore function in the lungs. Okay, so one thing that survival of this, actually it could take about 2 to 5 years from the time of diagnosis. It means that when this happens, it won't take just a day for the person to be able to recover from this condition called pulmonary fibrosis, because the scars need to be able to be removed through various procedures which we'll be talking about. Okay, so it takes about 2 to 5 years for complete restoration of function of the lungs. Yes. Okay, so we're talking about now some statistics. So which people are affected, are they males or females? So research has shown that males are predominant, that is, males tend to be affected by this condition more than the females, and as a result of that, they realize that they have 64.3 out of 1 million people who are affected. So this is a research carried out in the US, and as compared to the females, who have about 58.4, that is per million. So the research for males is 64.3 per million, and the females is 58.4. So that the males are likely to be affected more than the females. And also the most common cause of this condition is respiratory failure. That is, we have various organs in the body not being able to keep up their function. So 80% of this condition is as a result of fatality. That is, you're having car accidents where you have puncture to one of the lungs or both of the lungs. It could also result in what we call pulmonary fibrosis, that is, scars formed around the lung region. Okay, so we have other conditions that could result in pulmonary fibrosis. We have heart failure, we could have heart diseases, we could have bronchogenic carcinoma, that is cancer of the lungs, and we could have ischemic heart disease, we could have pulmonary embolism. So these are various conditions or various health related conditions that could present or could lead to pulmonary fibrosis. So you mentioned about signs and symptoms of this condition. So one may ask, what are the signs and symptoms of this condition? First of all, actually it's quite a long-term condition, as we talked about initially, that it takes about 2 to 5 years for the condition to fully resolved by all other means. One of the signs is that the person has difficulty in breathing. So when the person breathes, the person gets tired. With the very least activity the person performs, the person gets tired. And also the person has unproductive cough, and this unproductive cough is persistent. So the person coughs. So any moment in time, the person is coughing. So it might mean that the person might have other conditions, but with differential diagnosis, by giving other tests, we can say that the person has pulmonary fibrosis. The person also has shortness of breath. The person engaging activities such as walking, also performing activities, the person gets tired very easily, and so the person could have pulmonary fibrosis by the reason of other tests. As we talked about, it incorporates various medical professionals to come together to diagnose this condition. Also, the person too has greater levels of fatigue. So if the person does the least activity the person does, maybe standing for a long time, the person gets tired. Also, the person has low grade of fevers. So the person could have fever, high temperature, and so these are some of the real signs and symptoms that the person could have, and then we can narrow down to various activities, that is test, to be able to diagnose this condition. The person could also have muscle pain, the person could have joints pain, the person could have an unexplained weight loss, the person could have also clapping of fingers, so the person have the fingers clapping, and then sometimes the toes. Okay, so we've talked about the signs and symptoms. So now, what is the epidemiology? So when we look at various countries outside Ghana, outside Africa, what are some of the researches that have proved the fact that these people are affected? So according to research by in New Mexico, it stated that about 90.7 out of 100,000 people are affected by this condition called pulmonary fibrosis, and then they are mostly men. So in the US, is prevalent, that is, men are more affected. And also it stated that about 7.4 out of 100,000 are women. So generally we realize that there are more men affected by this condition called pulmonary fibrosis as compared to women. Okay, so also in the UK, 4.6 out of 100,000 people are affected by this condition. Though it is insignificant, research is saying that anyone can be likely affected. Yes. Okay, so in the US also, other researchers stated that 6.8 between 6.8 and 16.3 out of 100,000 cases are affected by this condition called pulmonary fibrosis. Okay, so a general population of people of about 2 to 29 persons are affected by this condition. Okay, so actually one of the important type of this condition called pulmonary fibrosis is the idiopathic pulmonary fibrosis, and we don't actually know the cause. Idiopathic means unknown cause. Anywhere you see in a scientific term, it means unknown cause. And so we have so many instances where we can have pulmonary fibrosis. We could have it affecting the connective tissue, it could have been autoimmune, and it could also be from the environment, through organic dust, inorganic dust, through fumes from cars, through gases. So we advise that we avoid getting closer or gathering in crowded places, and also don't smoke. Avoid smoking. It's very important, because smoking is one of the high risk factors for this condition called pulmonary fibrosis. If you smoke, or you know someone who smokes, in fact, please talk to the person not to smoke or avoid smoking. When a person feels like smoking, it can resort to other things aside the smoking. Okay, so some of the actually instances where you can have this condition is, some drugs also have the side effects of having this condition called pulmonary fibrosis. When you take some drugs, you are likely to have this condition. Also, you can have smoking. Yes, as we said, fumes, dust, infections are also cause pulmonary fibrosis, that is forming scars around your lung region. And also you can have radiation from x-rays, from gamma rays, from so many ways. And also we can have an autoimmune condition where the body destroys itself, that is, produces chemicals to fight against its own self. We call autoimmune. And there could be other conditions to that could bring about this condition called pulmonary fibrosis. Okay, so we've talked about the signs and symptoms, the causes, and so we just want to talk about a short description of how this thing comes about. So when there's injury to this part of the body called the lung, the body produces inflammatory response, that is, produces chemicals to go and then cause healing at the site. So if there's trauma, that is a blow or an accident, and there's injury to the lung, the body produces chemicals to heal the part of the lung. So in this case, when there's healing, the body tries to cover the place by producing something we call CAS. So as it covers the lung region, it narrows and makes the place smaller, so enough air is not able to come into the lungs, and this could affect oxygen supply to the heart and then ultimately to the rest of the body, and could cause the symptoms we mentioned earlier, such as shortness of breath, difficulty performing activities of daily living, and then so many, and difficulty breathing, and could have fever too. Okay, so these are the basic explanation for this condition. Okay, so we'll talk about some investigations for this condition. So one, we could have laboratory studies, that is, we could have use of antinuclear antibodies to be able to see. So when we take your test, that is your blood, we can find out whether there are antibodies produced by the body causing this condition called pulmonary fibrosis. We could have also chest radiography, so we take X-ray of the chest and we can see whether there is any formation of scars around the lung region, and then we can diagnose the condition to pulmonary fibrosis. We could have also high resolution computed tomography. We could have CT scan to be able to have a detailed structure of your lung region, and this helps us to diagnose this condition. We could have 6-minute walk test. So this one is performed by the physiotherapist, and you could check your endurance to walk within a particular period of time, that is 6 minutes, and then within a distance. The person or the doctor also can prescribe or can make you do a pulmonary function test, and this helps to see whether you have reduced function, that is, we can have vital capacity, functional residual capacity. There are various tests that we do, and this helps us to be able to diagnose this condition. We could have also bronchoalveolar leakage. So bronchoalveolar leakage is also a test by medical doctors to go to further diagnose this condition. We could have also transthoracic echocardiography. So it's mostly people call it echo. So we have of the chest to see whether everything is fine around your lung region, and then your heart region also, because the lung and the heart are very, very related. They are interdependent, the lung and then the heart. And also we could have also surgical lung biopsy, and this also helps us to be able to further see whether there are scars around the lung region, and then we can diagnose and then treat the condition accordingly. So in treatment of this condition, we have two ways. We have the surgical means and then the pharmacological or the therapeutic means. So according to the pharmacological means, that is treatment condition, we have so many medications that are taken to be able to diagnose or to be able to treat this condition. Okay, so we could have the cyclophosphamide, we could have the azathromycin, we have the N-acetyl cysteine, we could have phenphrenidim, and then so many medications by the pharmacists to be able to resolve this condition, that is forming of the scars around the lung region. And also some patients also require additional oxygen, so they put them on supplemental oxygen, that is artificial oxygen, to be able to get enough air into the lungs, because as we talked about, there are scars formed in the lungs, so they narrow the spaces, so more air into the lungs is deprived. So when you give in extra oxygen, that is, you could have something into your nose called nasal prongs, and this helps to push more air into the lungs, and open up your lungs, because the lung is very elastic, and so more oxygen into the lungs will allow the person to survive and live. Okay, so supplemental oxygen. And then also we could have the provision of one very, very important thing is the non-pharmacological methods, that is through physical therapy. So physiotherapy comes also in place to be able to give enough strength in the various body structures, such as our hands and our shoulders and our legs, and then restore function ultimately. So we have exercises such as aerobic conditioning, we could have strength and flexibility training, we could have educational lectures, that's educating the patient on the condition so that the patient can be able to accept and then follow the treatment accordingly. Also, we could have nutritional intervention, so the dietitian also comes in place. As we mentioned earlier on, it's a multidisciplinary team, so we have so many specialties. So the dietitian comes in to be able to ensure that the patient eats well so that the body system is in a good shape. Also, we could have the psychological or psychosocial support, so the psychologist will come into place, because in this case the person becomes worried, and so the person needs some advice, so the psychologist comes into place. So these all are aimed at improved walk distance and also improved quality of life for the patient, restoring the patient back to his normal state. Okay, so aside that, when you go through the surgical means, you could have also lung transplantation. So there could be transfer of lung from one person to the other to be able to survive, and this has shown to be very, very important. So by a special test called the lung allocation scores, it has been able to prove to be able to early diagnose this condition called pulmonary fibrosis, as compared to other conditions such as COPD, called chronic obstructive pulmonary diseases. We have emphysema, and then we could have bronchitis. So this score, the lung allocation score, helps to be able to diagnose this condition very early, and then the treatment is given early because of oxygen that will be deprived for the person to live. Okay, so the prevalence of this condition, that is, the people who are affected more are because of one, their family genetics. So if someone has had this condition called pulmonary fibrosis, it could be within the genes, so you are likely to have this condition called pulmonary fibrosis. Secondly, one important thing is cigarette smoking. So I said that we should avoid smoking cigarettes, and if you know someone who smokes cigarettes, in fact, it'd be good that you tell the person to stop smoking. Yes, avoid smoking. Yes. Okay, so as physiotherapists, our aim is to be able to restore function of the person, and also to be able to improve the quality of life of the person. So one, we're going to ensure that we maximize the quality of life of the person, the general health and well-being, and also one of our aims is to optimize the alveolar ventilation, that is the breathing or the lung capacity. So the person's lungs are supposed to open up more to receive oxygen. So there are various exercises that we go through, and also the patient to be able to have performing their daily activities without stress, and also we are aiming also to improve strength and function of the patient, and also to ensure the person is able to do his or her normal activities very, very well. So some of the exercises that we go through include aerobic exercises, so where the person can do a hands raise, up, down, and in, out, in, out. So that's when the person is active. But if the person is not so active or is under supplemental oxygen, that's artificial oxygen, the person does breathing exercises. So the person can breathe in and out, in, out. Okay, so this exercise can be done for the patient consistently, and this helps to open up the lungs and enables the patient to breathe in very, very well. So we could have also body positioning. So depending on the position of the person can be able to breathe very effectively. If you put the patient flat, lying on the back, the patient cannot breathe well. But if you incline the bed, that is you slant the bed to about 30 degrees, enough oxygen is able to get into the lungs, and this helps the patient to be able to breathe very, very well. And also we ensure that we do various active exercises such as relaxation techniques, pacing. That's if the person is active, the person that's walking up and down, to be able to ensure that the lungs open up and then breathe well. We could also ensure that there's good and effective ergonomics, that is where the person lives and where the person works, there is very good aeration, and also the person is able to sit well, and various positions of his office are arranged so that there is no tendency to stress his or her lungs. Okay, so we mentioned something called differential diagnosis. So some condition that could lead to this condition called pulmonary fibrosis include, we could have chronic obstructive pulmonary disease. We could have also sleep apnea. We could have GERD called gastroesophageal reflux disease. We could have coronary artery disease. We have so many conditions, but then when we diagnose by doing various tests, we can come out and narrow down to the condition called pulmonary fibrosis. So these people are very important in the treatment of this condition. One, the surgeon, the dietitian, the physiotherapist, yes, and the psychologist. So these are very important people to be able to ensure that there's effective and the best treatment is given to the patient, restoring the person to function 100%. Okay, so I thank you very much for your time. So we'll look at some pictures to be able to appreciate this condition. I'm sure we've talked a lot, and we are waiting to see some pictures showing us what this condition is. Okay, so let's see some of the conditions. Okay, yep. So just a minute, let's see. Okay, all right. So this is the lung. You can see the lung here. So we take an x-ray of the lung, and we can see reduction in the amount of airspace. You can see here. So the person could have scarring around this side. Yes, you can see if you compare this place to this place, you can see this abnormal display of the whitening of this place as compared to here. So the person is like to have fibrosis around this side called pulmonary fibrosis. Okay, so these are some of the scientific explanations. These are way beyond us. I'm sure we will have a hard time to understand this, but medical doctors will understand it. Okay, so this is a lung. We can see the lung there. Yes, you can see here. You can see the lung here. This is a zooming in of the lung here. You can see, so this is the rib here and the lung here. Yes, so this is scarring around the side. Okay, so you can see the lungs here. These are the lungs. Yes, so you can see this reddish sign are inflammatory signs, that is redness, and then after that it forms a scar around the side causing pulmonary fibrosis. Okay, so this is the lungs. So this is the alveoli where the air enters through. So the air enters through the side and goes into the lungs. Okay, so let's see whether we can have some more pictures. So this is a lung. Okay, just a minute. Let's see whether we can have some more pictures. Okay, so you can see the lungs here. Yes, so you can see the oxygen deprived here. So Yeah, yeah. Okay, so you can see the scarring here. So this is the full air containing space. So when the lungs begin to scar, they form scar tissue here. The amount of oxygen here is reduced, and this causes difficulty in breathing, getting tired very early. Okay, so you can see the lungs here. This is a very good picture of the lung. This is what we call the trachea. This is what we call the bronchos. The small ones are called the bronchioles, and then goes into the alveoli, and then goes into the lungs. So the air passes through all these ways before it goes to the lungs, and then goes into the heart. So you see how wonderful God is. So these are the causes of the lung injury, to resulting in pulmonary fibrosis. Okay, so I'm sure we've seen some pictures of this condition. Yes, and I'm very grateful for your time. Yes, I'm sure that we've learned a lot. Yes, we've been in a good position to explain to so many people about this condition. So if you have any question, you can ask any question. All questions are welcome. I can see Ebo, I can see Askandari, I can see Penda, I can see Imano, I can see Benny, yeah, Asari Bob yeah, okay. If you have any question, all questions are welcome. Yes. Yeah. We have some few minutes for questions. Yeah, so it's the last day of our presentations for the year 2020. And yeah, so if you have any question, if you have any suggestions, it's all welcome. Yes. If you don't understand anything, to please ask any question, and you are welcome. Your questions will be answered. Any question. Okay, so Dr. Adipo, yeah, I can see you. Yes, I can see you. Yeah. Any question? Now to yes. Okay. Any question, please? I can see Candy Ray. Yes, I can see also Seth. Seth also there. You have any question, please? Any question? Yeah. So it's been a wonderful time. Any questions? Okay, it looks like we are right on point. So if you have any questions, you can just call us 0540514092, 0540514092, and then we can solve any question that you have. So it's all about educating the entire populace and then ourselves also on various health conditions. So it's the foundation called RICOY Health International Foundation. And so our aim is to be able to educate and empower with focus. Okay, so any question, please? You are welcome. Okay, so no question. So resuming to our next topic. So our next topic for the new year, so the third Sunday of the new year, we're going to talk about a very, very interesting condition. Yes, I'm sure we might have heard it before, but let's see. We'll get to it. Okay, so the next topic is called osteoporosis. The next topic is called osteoporosis. Yes, so let's keep our fingers crossed as we come to learn a lot from this condition. It's called osteoporosis. I'm also writing it, so I'm also getting ready for this condition, osteoporosis. And so let's share the slides, let's share the flyers about, and let's expect a wonderful time also. So thank you very much for your time. May the good Lord be with us all, and a very blessed rest of the days of the year. We have about 3 days more, yes, for the rest of the year to end, or approximately 4 days. Yes, so we wish us all the best of the days of the year, and a blessed and a fruitful new year. May the good Lord be with us all. Have a blessed evening and a wonderful holiday tomorrow. Take care. Bye. Take care. Good night.